Okay, now I believe we can start our activities today. But before, I'd like to say that I'm delighted to welcome you on behalf of Science Arena and the Innovation and Science Diplomacy School at the University of São Paulo, where I was part of the inaugural class in 2019. So I know a little bit about this course that you are doing now. Insight's recent work is vital. Scientists, leaders, and civil society must unite to tackle humanitarian challenges, especially the climate crisis impact on health. Before we begin with the panels, I am pleased to introduce Sidney Klajner, our president here in Einstein, and our host and supporter. So please, Dr. Klajner, can you take your seat?
Good morning to you all and welcome to our pleasant building here, our teaching and research building. And I extend the warm welcome to this event, which we have great honor and pleasure in hosting, as it shines a light on an urgent, cross-cutting and global issue: the climate change and its impact in health. For those participating in person and those joining us online, this is a space for reflection, for discussion on how scientific knowledge, the capacity for innovation and liaison between institutions, countries, and knowledge can contribute on preserving the health of population in this somber scenario we currently face, and will continue to face if you do not build appropriate pathways and solutions. Einstein has sought to participate actively in this construction. A philanthropic organization with 70 years of background, Einstein is a health ecosystem with activities across the public and the private sectors in healthcare, education, research, innovation, digital transformation, and social responsibility. These varied fronts converge toward the proposal that inspires our organization to transform healthcare, widen access, and promote equality. Evidently, this is a proposal in which the climate change and health equation takes on increasing relevance. Sustainability is a strategic internal pillar of ours, with cutting-edge energy transition practices geared toward reducing our impacts and recognized through significant awards. We conduct a wide range of activities that go beyond our physical walls, driving transformations in healthcare, with special emphasis on the more vulnerable regions and populations from all perspectives, including the matter of climate impacts. One example is the telemedicine project by which Einstein physicians from across 12 specialties provide remote care to public health system patients in the north and midwest of Brazil, where there are no specialized doctors. In these locations, specialized consultation with these specialists may take hours or even days by boat, in addition to month-long waiting lists for appointments. And since the project started, more than 400,000 consultations have been made. Another project uses AI resources to evaluate skin images and assist public sector physicians in diagnosing illnesses that are often overlooked, such as leprosy, cutaneous leishmaniasis, and sporotrichosis. Generative AI is also part of a solution that helps primary care physicians in Amazon to conduct more qualified prenatal monitoring, aimed at identifying risks to pregnant women in reducing maternal mortality rates in the region, which are considerably high, the worst in Brazil. Another project primarily focused on Black and Quilombola communities involves analysis of micro and environment climate in urban and rural areas and their impacts on health. The objective is to provide the Brazilian public health system with the tools and data required to inform decision-making. The indigenous population is the focus of a project to create a platform for collection, storage, and integration of environment surveillance data, and to analyze water and soil to monitor environment health risks that lead to high levels of mortality in indigenous children up to 5 years of age as a result of something that is preventable. I won't elaborate further on other projects or provide the intricate details of our emergency response structure, such as the mission we sent to the southern Brazilian state of Rio Grande do Sul after the devastating floods that affect most towns and cities in the state and cause the healthcare structure to collapse. I believe that these examples give you an idea of our leadership in the area and the positive impact we have been made and we are able to generate. Large-scale climate tragedies generally attract more visibility and have more significant repercussions. But devastating effects of this incredibly sad climate new normal are all around us, undermining our health and quality of life. Vector-borne disease such as dengue, Zika, and malaria propagate in the usual places and find their way to locations where they never used to occur. New epidemics will come. We just don't know exactly when and where. And pollution and fires fill the hospitals with respiratory illnesses, while heat waves aggravate cardiovascular and other chronic conditions. Floods leave victims traumatized and impacted by outbreaks that follow, such as leptospirosis and post-traumatic stress disorder. With healthcare structures overwhelmed by emergency, chronic illnesses go untreated due to the lack of the access to care. Whatever the situation may be, vulnerable populations are always the most affected. We at Einstein have taken this theme to relevant international events, such as South by Southwest, the Festival of Innovation in Austin, Texas, and we participated also in the last COP in Baku, and will be at the COP 30 this year in Pará state, in the capital of Belém. Today, we are here hosting this event, which takes on particular significance given the upcoming climate conference to be held in Brazil. And now we have the historic opportunity before us to put health at the forefront of climate discussions and negotiations. As host, Brazil can and must play an important role so that we can come out this COP with strong commitments, including in terms of funding, constructing more resilient healthcare system, and integrating climate data with epidemiologic surveillance, protect the more vulnerable populations, and seek cooperation between countries and agents across a wide range of sectors. It is here that science and innovation diplomacy plays the strategic role. It has the power to bridge political gaps, to open channels for evidence-based dialogue, to formulate cross-cutting and collaborative and sustainable solutions that go beyond national and disciplinary frontiers. It invites us to look at the science as a common language among people and innovation as a force that can and must be guided by the public interest. When we talk about health and climate, We rely on science to understand the cause and effects, to model scenarios and propose effective interventions. We need innovation to develop comprehensive, efficient, and inclusive solutions, early warning systems, and resilient healthcare models. And we need diplomacy to align efforts and share knowledge and coordinate actions on a global scale. Not one country, no institution, nor any sector of society will be capable of facing these future challenges alone. And that's why this event is important. Here, we bring together scientists, public policymakers, representatives of national and international bodies, innovators, healthcare professionals, and leaders committed to constructing a fair, healthier, and more sustainable future. This is the space for connection and joint construction. May it be a breeding ground for ideas, rich in exchanges, and inspirational in proposals. The climate crisis is a health crisis. The elimination of this dual crisis depends very much on our capacity for dialogue, innovation, and cooperation. I wish all of you an excellent event, and I hope that this journey helps us to widen horizons so that the COP30 and beyond science, innovation, and health goes hand in hand with the response to the climate emergency. Very, very welcome.
Thank you, Sidney Klajner, President of Einstein, for this introduction. As a non-profit, Einstein focuses on positive social impact as reflected in the president's speech. Building on this commitment to social impact, Science Arena was launched last year by Einstein's institutional communications to enhance the visibility and social impact of the scientific community, especially in Brazil. ScienceArena.org is a journalism website focused on researchers. We foster direct dialogue between scientists and the public by curating stories that highlight researchers' perspectives, their challenges, and the societal relevance of their work. In this spirit, we strive to be a meeting place for innovative ideas and reflections on the challenges of cutting-edge science in a fast-changing world marked by risks and uncertainties. We understand the importance of initiatives that seek to disseminate scientific knowledge to a broad audience. To fulfill this role, our primary focus is on working behind the scenes, helping researchers serve society more successfully. This is the heart of our contribution. This commitment raises an important question. How can we expand the social impact of science when the work carried out by researchers often lacks political support, or when scientific activity is under attack and devalued? If science is threatened, then scientific careers are also undermined. In light of these challenges, contemporary issues such as climate change, one of the main threats to global health, are pressuring scientists to adopt new research, cooperation, and communication strategies. This requires to rethink the direction of scientific careers, their possibilities and limitations. Against this backdrop, understanding how researchers from different fields of knowledge can collaborate and how scientists can work with other social actors are among the many questions that guide our work at Science Arena. By listening to the demands of the scientific community and promoting open access to useful information and concrete initiatives, such as this meeting here today, Science Arena seeks to be an ally of researchers, especially those at the beginning at their careers, in building their professional identities. I encourage everyone to visit the Science Arena website to explore our content and initiatives. And we invite you to share your suggestions and partnerships ideas, allowing us to develop discussions and solutions that directly support and enhance researchers' work. With this context in mind, I would like to begin our first panel, which will discuss the role of science diplomacy and how to articulate knowledge networks in times of climate crisis. Please welcome our panelists, Luiz Vicente Rizzo, Research Director at Einstein, Marcelo Nobel, Executive Director of the World Academy of Science, Annie Slovic from the School of Public Health from the University of São Paulo, and Guilherme Ariplonsky, Professor at Institute of Advanced Studies, also in USP. Annie and Ariplonsky will join us via Zoom, as they are currently outside Brazil. So they're gonna appear here. But before I have just one final message. We received many registrations for this event. To avoid delays to our schedule, and because some members of the audience here will participate in another activity in this afternoon, we kindly ask you to submit your questions using the QR code we are gonna place on the screen, and the link we are gonna share in the Zoom chat. Okay, so you can submit as many questions as you like. In the coming days, we will forward these questions to the speakers so they have a chance to answer them directly to all of you. Thank you for understanding, and please, Dr. Rizzo.
Hi, good morning. For those of you that I haven't seen today yet, I'm pretty sure that some of you are pretty tired of hearing my voice. I apologize for having to have this extra 5 minutes here. Thank you so much for being here. Thank you, the speakers. Thank you, Dr. Klajner, for hosting this conference, and the group at USP and here at the Science Arena for organizing it for us. I think that I like to say that the science is not my job, it's my way of life. And that's a little bit of what I wanted to talk to you about. Some of you that were in the tour heard about the ideas of the way Einstein sees science, how we feel about sharing, data sharing, information sharing, education, and the fact that we firmly believe that there is no other way to practice good science or good education without exchange. Therefore, diplomacy. So this is the justification for us to be here. But science suffers from a very important problem these days. And this was pointed out by Carl Sagan, one of my idols, a long time ago. We have a very technological society that hardly knows a bit about science. And the fault, as pointed out by another idol of mine, Richard Feynman, is all our science teachers. If you don't like science, said Feynman, it's because you had a bad teacher. Most of us, if not all of us, learn science through its facts, through its accomplishments. So we founded in our minds the idea that science is the end of something. Science is not truth. Science is the relentless, unwavering pursuit of truth. And that, as I said, should be a way of life, not just the way the scientist works in the laboratory. Truth is the goal. It is never the end of anything. And that's the problem that we have, and that's something that we must address. And the only way to address this is to different views, different perspectives from different countries, from different cultures, from different ways of growing up. Because the way we learn science was not what science is about. Very few of us, during the time that we were really learning science, not when we went to undergrad or graduate school, but when we were in the bench of the fundamental studies, we learned facts. We didn't learn scientific thought. We didn't learn scientific method. And the most important thing on both thought and method is the antithesis and not the antithesis of what you do. It's not about what you think, it's about what facts can prove. It's about how to question facts all the time. And that's why diplomacy is so important, because different people in different places with different backgrounds will have different views about the same fact. Most of us learn about atoms with the Rutherford model of 1933. If we look at what an atom, or what physicists think that an atom look like, very few of us would recognize that we learned on the benches when we were in first grade, second grade, third grade. And that's the failure of teaching science. Science should be taught, and we should discuss science, not based on the facts, because the facts change, no, but because we learn more about them and we can understand them better. There's no more important way of looking at this than when we are talking about climate change and the changes in the environment. So I would like to welcome you all, welcome the panelists here, and without further ado, I'll move on to Professor Marcus Knobel. Professor, thank you.
Well, good morning. My name is Marcelo Knobel. I am from the World Academy of Sciences. I would like to talk a little bit about it. It's a new experience for me. I am originally from Argentina, and then I moved to Brazil in '76. I studied here. I am a physicist. I work at the University of Campinas. I am professor there. And then I finally became a rector. And after that period, I now had the opportunity to go to Italy, Trieste, Italy, to be the director of the World Academy of Science. That it was a really interesting idea developed about 40 years ago by a Nobel Prize winner, Abdus Salam. He started an institute of physics and mathematics there 60 years ago, and he realized that it was important to develop an academy of the best scientists in the developing country. In that time, it was known as Third World, and it became the Third World Academy of Sciences, then changed because of the nomenclature and so on. And it has been evolving as a very interesting place, which has a very clear but very difficult mission, which is to enhance, to improve science in the developing world. And we have been doing that. And he was amazingly interesting character, because he managed to convince then, 40 years ago, before he became a Nobel Prize winner, he convinced the Italian government to give a core funding in order to have that place there, together with the ICTP, which is the International Center of Theoretical Physics, together with the World Academy of Science. Trieste emerged as a center of research. And this happens in many, many places. I come here from Campinas, which is nearby, and it happens something similar in different proportion over there. So it was born as an academy, but then it developed as a normal NGO, let's say, because we are now an office, a part of UNESCO, is from the UNESCO system, but we don't have any, don't receive any money from UNESCO. On the contrary, every single money that we give them 7% for the the overheads and so on. So we had to develop as an agency or a catalyzer for global South development, and this has been done in the last 40 years. We have many fellowships and programs. I will not have time to talk about them all. You can take a look afterward. It's very easy. TWAS.org. There are many programs, projects. Among them, there is a very interesting science diplomacy course. It happened a few weeks ago there. We have this science diplomacy for more than 20 years together with the IIIS from the United States, and it has been extremely well known and as a success story. It's one of the best programs that we have there. Just to tell you that we had more than 900 applicants for 20 places this year. So it was really difficult to get, but it's a very interesting experience as well as this one here. What I want to talk about just a little bit is that we have been seeing, and we should talk, after doing this kind of formation, there are many of these kinds of workshops and science diplomacy capacity building in the world, which is really important. But then after that, what we should do? How can we really improve the quality of life, reduce the inequalities within our countries, and how we can really develop that? This is the next step that we should think together. And organizations like this one and other organizations are among the Global South should work together in order to do it. Otherwise, we will be always dependent on the external help. I recently published a paper about that, saying that even for the Global North, it's a strategic imperative to develop science in the Global South. It's the future of science, and nobody's talking really about that. Just to mention some numbers, which I think are really important. By 2030, let's say after tomorrow, 40% of the young population in the world will be in Africa, 40%. We will have a reduced population in Europe and in other countries. So there are universities that will have to rethink, just to mention universities, which is my field, they will have to rethink themselves because they have no more students. And now with the, these political issues, geopolitical issues of the visa, traveling, and so on, uncertainties in the world, they are really struggling to survive. We need people from the local communities to address the climate change that was mentioned before, to address the local health issues. And this just can be done by supporting the scientists in their places. And this is the kind of programs that we are still lacking. Of course, talent is spread all over the places, and the strongest institutions fight for them, and they try to attract them. But we, as part of this community, let's say in the Global South, should work in order to avoid the brain drain and give perspective and possibilities for these talented young affiliates, young researchers to work in their places. So just to mention that TWAS has now today 1,400 fellows, which are among the best scientists in the Global South. And we have also a category which is young affiliates. We have about 400 young affiliates. We have more than 50,000 people in our mailing list. We have a strong network of science in the Global South. But this is not all. We can have the network, but if you don't activate this network, if you don't engage this network with current programs, projects, ideas, and possibilities and opportunities, we cannot reach anywhere. So I am just, in 10 minutes, it's very difficult to elaborate much, but of course, this is more than anything just to mention about our work, to call you to participate as well in this network and try to make ideas, projects together for a better world. Thank you very much.
I try to do it from there, but I guess I'll exercise a lot. I'll call on Professor Ann Dorothy Slovic to talk to us now. She'll be online. Thank you so much.
Thank you for this introduction and for having me joining such an amazing panel. Bom dia a todos, buenos dias. It's a real pleasure to be with you. Time is short, so we have a very important topic here to cover. As Bruno mentioned, I come from the School of Public Health, University of São Paulo. I'm actually a collaborative researcher with the Global Health Program and Sustainability. And that's why I'm here with you as well, talking about such an important topic as climate change and all the related risk that we are facing. I have been in research long enough to just know that we have been talking about some of the same topics for a while. But now we have these emergencies when we're talking about climate change, and time is pressing, right? So what we see now, and some of you are probably familiar with it, we have seen that climate crisis is really increasing the risk of new outbreaks and disasters. And we're having an increase of all these extreme weather events, and which has driving the rise of pathogens, the spreads of which, and increasing the health impacts. So we're talking about rising temperatures. We're also talking about political instability. And when we face political instability, we're also talking about limited budget. And all this can hinder all adaptation efforts, right? And it's a very difficult time for research, because when we're also facing these moments, we're also facing doubt from people that's actually going to be the most affected by all this climate crisis and all these climate events. Is it real? Should we actually be spending money? And should we actually take actions? And should we actually participate in international organizations to tackle the issue? So all that is actually some of the greatest challenges we're facing right now, right? And also when we're talking about this climate crisis, and I come from the environmental health sector, but we can never forget that also means cost, because at the end of the day, we are facing lives, we're facing costs in health, we're facing costs for governments. So just to give you an order of idea, between 21 and 23, we had thousands of casualty and economic costs due to climate damage. And that's raised, the OECD just released a report that was saying that between 25 and 250 and 280 billion of costs reported to climate-related events. So it's very hard for us researchers to kind of understand why there is so much doubt and so many challenges that we face to actually continue developing research where we bring strong evidence base to influence strong adaptation policies that most of the world really need, right? We're always saying, talking about how, the vulnerability of some population. We know that the global south, or some of our previous speakers were thinking, are going to be most affected. The African continent is one of them. But we can forget that this is affecting all of us, right? Just in Europe in 2022, summer 2022, we had about 62,000 heat-related deaths. Some of you might be familiar with the episode of 2003 with the big European heat wave that we had about 70,000 deaths. So we can't just say it's one problem just to one place. No, it's a problem affecting all of it. But even so, we have still this challenge of building solutions altogether. So if you allow me now, I just wanted to talk briefly about the research that I published. So one of the things that's more important, and that you, from what I understand, and I regret that I'm not there to actually exchange and talk more with some of you, but we need to have stronger collaborations. And there is this project called Salud, which is a European health in South America, in Latin America. And I was privileged to participate and to be part of this project for a few years. And we actually looked and viewed the perception that cities had when they were reporting climate hazards. And it's interesting because I think as Teresa was talking about how people have different views on different topics. And this is true in Latin American cities when the public officers are reporting the hazards in the cities. And we see that, you know, some of the most reported related hazards, climate hazards, are storms, water scarcity, extreme temperatures, with like 52% of this hazard reported in Latin America. And cities in Latin America, like, and we looked at 124 cities in Latin America, they report about an average of 3 hazards per city. Okay, so we're talking about something that's greatly also affecting Latin American region, and that's that we're still, though, lacking to address when we're looking at adaptation policies. And now, if you allow me to, I also would like to talk a little bit more about the Global Health Program at the School of Public Health. This program exists since 2013. We have the particularity to foster interdisciplinary research, right? And we want to look at the critical approaches in the emerging issues of climate change and all the global health issues. What differentiates us at the School of Public Health from other programs is because we have this diverse body of students, which brings a different lens when we're talking about global health, right? We're talking and looking at students that come from anthropology, that come from sociology, some are medical school, some come from a more economical background. And so we're able to have a research that combines all these centers that we so much when we are talking about tackling the issue. We have actually since the program was launched, we had 63 graduate students, and we currently have 51 doctoral students. We have several lines of research, but the 2 main lines is we're looking at international policy systems and institutions for global health and a sustainable environment, but also we look at sustainability and livelihoods, right? So some of our research include looking at pandemics. We published a book for the 10 years of the program, where we looked at the effect of the pandemics with the lenses of global health. Obviously, we'll also look at ethics, but also migration, the environmental degradation and its health impact, like such as climate change, and also, but things like also like mental health. Also, we look at the diplomacy part of things, like how is global health actually integrated? Because there's no research that's going to be sustainable. There's nothing that's going to be sustainable if all sectors don't work together tackling the issue. So now I'm going to try to go back to a question that Bruno actually sent to us, that was speaking today to the panelists, and he was asking how we can organize this international network, research network, and enhance the global impact of science on climate change, and what's its implication for planetary health. This is a huge question. This is a big question. But I agree with some of the previous panelists. We need to recognize the importance of the social determinants of health, and always look at our research approaching and addressing socioeconomic disparities. The idea of climate justice is being brought at every COP. We are about to have one in Brazil right now. Last one wasn't that successful, and I'm sorry if I'm giving an opinion that might be a little strong. So we're really hoping that this one is going to be a good opportunity for us to address all these issues. We need to look at a health problem, understanding that it encompasses not only the health or the disease in itself. We need to address the vulnerability. The vulnerability is not only just the population, it's also the income, it's also where you live, it's also how you live, because this is really going to make you resilient or not to climate change. And most likely, poorest are the ones that are going to be most affected. So when you hear that 40% of the world population is going to be in Africa, and we know all the challenges in some of the African countries to actually build this resilience, it's actually very alarming. Right, but just because time is short, I also want to talk about a little bit this global South cooperation. We've been talking about it. We need to strengthen it. Salurba was a great example. The project on urban health in Latin America, led by Drexel University, in Ana Diaz Ru, and Olga Lucia Sarmiento in Colombia. Because it actually brought about 80 researchers together to look and foster and ameliorate research in Latin America. And we know Latin America is a region that's going to be very more urbanized. We know that we need to also look at urban health. We need to look at these problems and what kind of adaptation efforts are there. But it's also mean concretely that we need to think about the discolonization of global health, right? Often financing of projects come from the northern hemisphere, and the agenda and the goals might differ, even if the problem is the same. So I encourage, if I have like to give some advice, is like continue fostering this cooperation, continuing strengthening this cooperation, and let's build together a way where we can actually try to get our own financing for our publication. But that also means, you know, when we researchers want to publish in high impact factors, we also have issues to publish because it's extremely very high low cost. So how can we actually enable access to these high impact factors journals, so that all these countries that actually are struggling with so many other issues that are certainly not the publication in a high impact factor, but can have their research out there and help policymakers to make better decisions and make more sustainable decisions, right? So I just wanted to go back also to some of the findings of the articles I was mentioning about when we looked at reported climate hazard in Latin America. We also looked at what also makes city, what kind of city report more hazards than others. And we saw that, smaller cities, so less populated cities had fewer hazards, fewer floods, fewer biohazard. But when we looked at cities with high density, with a higher GDP, with higher education, with a greater level of greenness, that are all indicators that we looked at, we also saw that they reported more hazards, right? So this also shows like what we still need to do. How can us researchers help you policymakers, to develop these actions that were greatly needed? So also just to think, when we looked also at the challenges that these cities are facing in Latin America, we saw that there is a hard time to bring public health, to think about health when you're thinking about disasters, which to me, coming from global health, is completely obvious. So just to, I know that I would like to go on and talk more with all of you about these issues, but there are a lot of studies out there that actually have proven the importance of tackling the issue by government and how it could actually improve up to enhance their GDP. So I invite all of you to continue these conversations, and I'm open to receiving your questions afterwards, and I'll be very happy to answer. And thank you very much for this invitation today.
Thank you, Anne. I'll go call upon Ari Plonsky. Ari, are you there?
Oh, I'm here.
Good. So you show up eventually. There you are. Thank you, Ari.
Hi. I need to share a presentation that I hope is already around the screen. Yeah, here. Share.
It is on the screen, Eddie. It's already there.
Is
Thanks.
it okay?
Yes, yes. There you go.
I have to try to minimize here. Okay.
Thank you.
Okay. First, it's a pleasure to be part of the 7th edition of Inside, this time together with Einstein. And personally, it's also very comfortable as I am on both sides active, both as with Insights that I've been since the first edition, and at Einstein that I have the chance from 3 different positions to see the marvelous work that is done by President Sidney Klajner, by Rizu in the area of research, and by Bruno in the area of communication of science arena. The questions that was posed to us is, in practical terms, I understand, how to articulate knowledge networks in times of climate crisis. And I would like to provide in this few minutes a concrete initiative, the Planetary Health Initiative. What is planetary health? Planetary health is a solutions-oriented, transdisciplinary field and social movement focused on analyzing and addressing the impacts of human disruptions to Earth's natural systems on human health and on all life on Earth. I'll explain how it was created, but I have to present here what I want to present as a case to answer concretely the questions that was posed to us is the Planetary Health Alliance. It is a growing consortium of universities, NGOs, research institutes, and government entities from 80+ countries committed to understanding and addressing the impacts of global environment change on human health and well-being. That is exactly the focus of this panel, I hope. The main documents, the start of this initiative, Planetary Health Alliance, is the documents that you are looking. The Planetary Health Report, as it became known, gave rise to an international movement involving research, education, and knowledge translation with an impact on policies, products, and processes in many sectors of society. It resulted in the creation of an international alliance, as I mentioned, the Planetary Health Alliance, an annual event, the Planetary Health Annual Meeting, the establishment of chairs on this topic at universities around the world, as Harvard, Sydney, Oxford, and others, and a specialized scientific journal, the Lancet Planetary Health. In September 2015, a few months after its global launch, University of São Paulo promoted the presentation, the dissemination of the Planetary Health Report in Brazil with the participation of one of its main contributors and authors, Sir Andy Haynes of the London School of Hygiene and Tropical Medicine. The same event also saw the launch of the report Connecting Global Priorities, Biodiversity and Human Health, promoted by the World Health Organization, the Convention on Biological Diversity, and the United Nations Environment Programme. As a result, the University of São Paulo was invited to join the Planetary Health Alliance, which had just begun a few months before, and which at the time was being created, led by and based at Harvard University and supported by the Rockefeller Foundation that also supported, as you can see, this Lancet very important study report. Since then, University of São Paulo has participated in the Planetary Health Annual Events, Alliance Annual Events, and was encouraged to take on a role as an organizer in Latin America. A planetary health Latin America and Caribbean hub was then created within the Planetary Health online community. Planetary Health Alliance online collaboration tool under the leadership of my colleagues at University of São Paulo. In 2019, the year, as Bruno mentioned, that the Insight was created, USP was invited to be a member of the Planetary Health Alliance Steering Committee. And then something crazy happened, because it was scheduled to have the 2021 Planetary Health Annual Meeting in São Paulo. But it was in the middle of the pandemics. And the decision was to maintain the event, but obviously to do it on a virtual platform. And what happened is that the original idea of having around 200-300 participants became a meeting with over 5,000 participants from 120 countries. It's not easy to, at the time especially, to organize such a large meeting. So the conclusion of that meeting was the São Paulo Declaration on Planetary Health that you can find. You have the link below. Basically proposing concrete actions for all. It means we have much information. Obviously, we need even more information, but we have a lot of events, seminars, papers, etc. But the main issue is to act, and to act wisely, and to act fast. This São Paulo Declaration was anyhow screened or prepared and screened by a lot of people from a lot of countries, had the support of the UNDP, United Nations Development Program, is available in these languages, and was published in October 2021, immediately after the São Paulo event in The Lancet. Obviously, also a Brazilian planetary health network was created, which has nowadays around 190 plus individual members. So these are people from universities, research centers, state agencies, NGOs, covering all areas of and all regions of Brazil. It is hosted at the Institute of Advanced Studies at University of São Paulo, and you have also the link to the Brazilian network here. You can see this cosmos of institutions to whom people belong that are part of the Brazilian, let's say, hub of the network. And you see on the top, in the middle, you see that Einstein is also, to our satisfaction, one of the members of the network. It operates according to working groups: education, food systems, communication, citizen science, sustainable aging, climate change and health, engineering, art, nursing, because as it has been mentioned by the previous speakers, we are talking about a systemic issue. I mean, really two systemic issues that are brought together. A systemic question of which is health, and a systemic question which is the climate environmental issue. And so it is an effort that has to be tackled in different channels. There is an ambassadors program to spread the word. There is also the Latin American hub, as I mentioned, and also we take care every year to disseminate the Lancet Countdown Annual Report. It means how the proposals are evolving, what are the results, what are still the challenges. Since November 2023, the international base of the Planetary Health Alliance was moved to Johns Hopkins University with the Johns Hopkins Institute for Planetary Health. as you can see, as this journey began in 2015, we are now 10 years on the road, and the message of Professor Antonio Mauro Saraiva, my dear colleague from the engineering school and also from the Institute of Advanced Studies, that you can see, and everything you want to know, and if you want to have more information, and hopefully if you want to be part of this social movement, please contact Saraiva. He knows obviously of this presentation, and it is will be really a pleasure having you to participate. And as I am about to finish, I would like to, after hearing Dr. Sidney, Bruno, and Dr. Rizzo, and Professor Marcelo, good friend. I'm sorry that I cannot hug you, but good to see you at least in the screen, and Professor Slovik also. I would like to finish with an expression that I learned recently, which is knowledge-based hope. It means the expectation that a deeper understanding of the past journey, in this case of science, technology, and innovation, will open new opportunities for the future. I think, Rizu, you are the boss of this session. I think if I can continue what you began, this is a message that I think we should carry, because as Professor Saraiva mentions on the second line that I quoted him, 10 years on the road, true, but yet a lot to be done. So knowledge-based hope, have a wonderful continuation of this important event.
Thank you, Ari. As you probably all are aware, we are a little bit on the late side, so please direct the questions through the QR code. I would like to thank Professor Knobel, Professor Slovik, and Professor Plonsky. Thank you, the audience, and I ask Bruno for 1 second to do an advertising. Since people mentioned publishing, Einstein maintains a journal. It is Medline. It has a JCR impact factor since last year, and it is also a diamond journal, meaning it is full open access, and it costs nothing to publish on it. And it's real-time publishing, so there are volumes. If you are interested, as I said, no cost, with an impact factor. The address is journal.einstein.br. We would love to see articles from all of you. And please, thank you so much. Enjoy the next sections. Thank you.
I would like to thank the speakers of this first panel. Now we are going to start to begin the second panel about challenges for global science in light of new epidemic risks. This panel will discuss one of the topics that we want to address here is how can we ensure effective sharing and analysis of extensive data on global health, including information on disease, treatments, risk factors, health indicators, and other relevant data for decision making. But before I present you the panelists, I would like to highlight that you can send your questions by using this QR code, and the people in the Zoom just click on the link that we put there. And I also want to ask that our speakers pay attention to the time in their presentations. I know that 10 minutes it's very, very short, but it's what we get here today. Okay, so now I would like to present for this panel Edson Amaro. He is responsible for advanced technologies and global data at Einstein. Sue Ann Clemens, professor at Siena University in Italy. Eric Harnisch, Vice President of Provider Market at Mayo Clinic Platform. And Jerome Kim, Director General of the International Vaccine Institute. Please, I think only Edson is going to be here in person, and the others are online. Okay, thank you.
Okay, so good morning again. So the idea is to keep the time, but also to highlight a few aspects that each one of us in this panel can perhaps comment with more either experience or at least qualified opinion. So my role here would be basically discuss the aspect of data, how we monitor the effects of weather and climate change and atmospheric pollution and water pollution into human health, particularly with the emphasis on equity issues related to the populations we have here in South America. Again, more precisely, those that are part of the studies that Sidney mentioned at the beginning of our talk. So my background, it's I'm a neuroscientist actually, but I've been working with healthcare data for the past 10 years. And we've been working with large-scale projects with the Brazilian government, trying to help to provide information related to not only data connectivity, but what are the implications of having the correct data in place when you want to take actions that will impact on people's health. So I'll start with atmospheric pollution. So Brazil lacks the number of reference graded air monitors. As a comparison, Brazil has around 250, maybe more or less, of those reference stations, whereas in the US there are more than 10,000. So we don't have the information we need. Particularly, and very interesting, those that we have are not located in potentially the areas that suffers the most with the increased level of atmospheric pollutions. There's a work from University of Chicago, the State University of Rio de Janeiro, showing that at least in Rio de Janeiro, the areas that have the highest level of ozone are not close to the stations that are measuring air pollution, particularly in the case of human health. The highest levels were also detected where you have the higher number of children and old age people, which is again contradictory because those are the ages that suffer the most when you have variations in extreme temperatures. Another fact is that we have some alternatives. We do have dynamic monitoring, so we have monitors that can be used on top of cars. We have monitors that can be used in-house. Those are typically with less quality, low cost, but they also provide what we know in medicine, that is the engaged patient. So we know what are the damage to our health if we know what we are exposed to. So there is some efforts in order to integrate information from different sources. Satellite images are very, very interesting because they provide a wide coverage. Some of the satellites, the stationary ones, can provide real-time data in the fraction of a minute nowadays. They lack specificity, but we have interesting results, at least, again, here in Brazil, in Salvador, for instance, there's a study that was performed before the pandemic area where we show that there's a very, very good correlation between the measurements that you collect from satellites, at least in particulate matter 2.5, which is a very relevant air pollutant, and what we measure in the reference grade air stations. We do have to address the point that I mentioned about equity. So if we don't know what's going on in those populations, how can we take the appropriate measures? So I think there's a urgency in providing data from those communities. So the last part that I wanted to address is how to connect everything. So satellite images, it's a huge volume of data. Public health data is usually very difficult to integrate. And when we want to take actions, it's very direct to say that we know that certain air pollutants can cause damage to people's health, but where, when, and who is going to be affected? These are the questions that the public sector and the private sector want to know in order to provide primary care. In other words, the community health agent in Brazil, it's a large force, more than 100,000. It's a beautiful thing. Again, one of the pillars from the public Brazilian healthcare system. And these people, they visit their neighbors at least once every month. One community health agent on average visits around 200, depending on where you are in Brazil, 200 families. So have a constant communication with the population. And we can provide information to them. The question is, can we provide the right information? In other words, we know that there is weather forecast, right? So now it's unfortunately very common to see that we have a huge variation. So we know that, for instance, this week is going to be very cold in certain areas of Brazil. So what? What are the typical measures we have to take in regard to prevent healthcare impact from those variations? Who are we going to tell what to do? So those are the important questions. I remember one last example given by my professor and tutor, Paulo Saldiva. I used to do scientific initiation when I was a medical student with him. He used to say, it's very hard when you have a very low salary and somehow you have to provide fuel for your car and you have to choose between ethanol and in Brazil we have hybrid cars, right? And gasoline. You don't think about the polar bear. You don't think about the Brazilian mico-leão dourado, you know, those species that are endangered by climate change. You think about what I'm going to do if I don't work and provide food for my family. So we have to really take into account what are the urgent needs from the populations and the impact of climate change in their health. And the way to do it is to provide a more strong and robust data integration. Again, technology is there for us. Most of the models we're using today are based on AI. They're performing much better than usual traditional methods like LUR, so land use regression, for instance. We have now models that are outperforming in the order of at least one specificity, in particular to PM 2.5 again. We also have new monitors that can be made on top of cars, then we can monitor the huge areas where we have traffic. Just to mention that in Latin America, we have double the pollution in traffic areas compared to Europe and the US. And in some cases, we can see dramatic changes, like, for instance, in Beijing, in China. They've been able to reduce their pollutions fantastically. I mean, it really depends on government and societal changes. And this is nothing that we can do alone. But at least I'm sure that providing data, if we provide data with the quality necessary, we have a very strong case to defend. And we can provide that over time, saying, look, if you do this particular thing, you can have a positive effect. So I hope that providing integration between healthcare data, high dimension data from satellite low-cost monitors, and even reference-graded air monitors is the way for us to have a powerful tool to inform the society on what to do, again, to take care of the families that are in most need in our fragile population. So with that, I finish my presentation, and in the order, I think we now are going to hear from Professor Sue Ann Clemens, and she's a professor at Siena University. I believe she's going to talk to us from the Zoom. So Anna, over to you.
We'll share slides. Please let me know if you can see them. Can you see the slides?
Yes, we can.
Okay, so good morning again. A very important aspect for the pandemic preparedness is to secure budget. And we can see in this slide that a global military annual budget back in 2022 was 50 times higher than the pandemic preparedness needs. And that was again back in 2022. Imagine now, with big cuts in research and health, and I can mention an example from yesterday, which was the US de-investment in mRNA vaccines research and development. So, I mean, I think we can think about the difference in numbers today. But back then, we could really secure a budget, and we could have an unprecedented pace for vaccine development for COVID. And that led to the biggest ever vaccine development program we have seen. And the consequence of this was a global health achievement, a very successful one. We could save in the first year of vaccination more than 20 million lives. I was on the front line of vaccine development for COVID, and that helped me to see and map the gaps that we were facing during pandemic. And I could place them in 4 boxes: surveillance, vaccine and drug development, manufacturing, and access. With regards to surveillance, obviously we need to have a good infrastructure and very good capacity building trained personnel. For vaccine and drug development, what we could see was, gratefully, many vaccines were coming into phase 2 and 3, but we didn't have a quality network of sites to conduct the trials that were coming into phase 2 and 3. And this was aligned with also a gap on qualified personnel. Another very important gap that we saw in this area was a lack of laboratory for clinical trials assays. Another very important aspect was regulatory. I think for the first time ever in development, the world gave the proper, let's say, importance to the regulatory continuous submission, but also a harmonized review. Manufacturing. We did see lots of tech transfer, and we could see that tech transfer could come in volume, but also in shorter periods. The challenge now is how can we keep this coming and how we can keep the time shortened. Another big point was the drug substance, the monopoly that we saw. And it doesn't help if we do have a product and we don't have access and equity. All through the steps, we need to ensure capacity building, and another big gap we saw was global leadership. Going into details about surveillance, very crucial to surveillance and to pandemic preparedness is pathogen sharing. And that is because, yes, we do have WHO guidelines, we do have the Nagoya Protocol, but still, we don't have a very well-defined legal and regulatory framework. And that goes also with the aspects of shared benefits and having a global platform. As I mentioned, one of the big gaps that we saw, and actually I had some students from Siena doing thesis on this, coming from governments or scientists, we all felt a big gap in leadership. And that is really concerning because right now with the big cuts as we saw within WHO and geopolitical aspects, leadership is still very uncertain for the future pandemics. That led at that time, talking about leadership, that some experts got together and mentioned this to the G7 leaders. I was one of the experts that had the opportunity to be part of it. And we really, amongst all the things we've said so far, we really highlighted that a global coordinated approach was needed. As an action of this came the 100 Days mission. It's ambitious, it's essential, but I'm not really sure we are there to say it's achievable. And at last but not least, talking about climate change. Yes, we all talked about this so far, and it's still more than 13 million deaths per year, according to WHO. And we have different impacts caused by different factors, increasing in temperature, spreading of infectious disease, quality of air and water, and food insecurity. And that leads to increasing deaths by dehydration and ischemic diseases, increases due to environmental disasters, increase of vectors, and those numbers are outdated right now due to the last disasters we had, but also a very important increases in AMR and leading into mutations and increase of viral variants. And according to talking about quality of air and water, yes, we do have an increase in respiratory diseases. We do see through pollution of air, 13 deaths per minute in the world, an increase in diarrhea, cholera, allergies, and etc. And food insecurity, malnutrition, and deaths. And all this together, plus the day-to-day and neglected diseases of our healthcare system, we see a collapse of the healthcare system. And as Dr. Sidney said, very well said in the beginning, we do need diplomacy to coordinate global actions. Thank you.
I believe now next in the line it's Eric Harnisch. He's the vice president of the provided market at Mayo Clinic Platform. So Eric, the stage is yours. He is going to speak via Zoom.
Thank you, Edson, and it's very nice to see everybody. I think it was just March of this year I was in that room with many other fellow Albert Einstein folks celebrating the conference he held in the spring. When I got ready for this, I think what's really interesting with this topic is I am from Minneapolis, Minnesota, which is where Mayo Clinic Rochester is roughly located, the north part of the United States, central. And when I woke up this Saturday morning, like many mornings the last few months, we had the 5th worst air quality in the globe. And that struck me as an area of renown for lakes and natural resources. And to give you an idea, the groups that were ahead of us were the Congo, parts of India, Baghdad, Iraq, and Dubai registered worst air quality. Now, the reason was for the last couple of years, we've had Canadian wildfires. There is a real threat with changing climate, changing precipitation that's caused these fires to burn longer through the year. Natural forest fires are natural, but these are significantly worse. So it's put a big burden on cardiovascular and chronic disease people in the United States, just when you look at the smoke pattern. So I just say none of us are immune to this issue, and it's really working together that we need to come together. And that's what Mayo Clinic has been working with Albert Einstein and many others. So I'll say that maybe start a little bit with what is Mayo Clinic's strengths in this area. We've been leading a healthcare system with an integrated approach, and that means the research of health, the practice of health, and the education of health. And it's really through that patient care. We made a decision about 6 years ago to create a platform group, and really it was to start to think about how do you make a broader impact globally with data as a foundation. And what we did was we de-identified all of our 10 million patient unique records and began to look at things like social determinants of health. And what we found very quickly was, wow, it was interesting to have Mayo Clinic's data available. What would we learn if we brought together the world's leading providers that had like-minded interests in research and see data from across the globe? And so that's where we really got introduced to Albert Einstein and about 8 other organizations throughout the globe to make our data interoperable, to use advanced analytics and AI, but at the same time, maintaining privacy and security through federated architectures to ensure that patient privacy. Now, kind of back to climate change, it's accelerating. When we signed one of our latest partners, Aga Khan, who is in East Africa, Kenya, I went to a conference there and spoke, and it was interesting because they were the first conference that I'd been to that was tackling this health topics along with climate crises. And what is unique, and we've talked a lot about vulnerable populations today, is that the warmer temperatures, the altered precipitation patterns, and have really impacted these vulnerable populations. They were specifically, these areas lack economic development and capacity to help their populations much differently than maybe global North organizations, global groups that are not in that emerging market. So we worked a lot with talking about how do we combine the health data with weather data, and how do we look at other things that would help their farmers potentially grow differently, do different techniques. So again, really emphasizing that the climate crisis is real and that we need to work together. I would say that some of the challenges with this type of research is ensuring, again, if you're working with clinical data from populations, that you're doing it in a federated, secure manner so that you can study and not risk re-identification. We de-identify, anonymize all of our data, so it's very secure, but that is always a risk as you bring in new data sources, as you link new data sources. How does that impact the risk of re-identification of the data? So that's kind of a foundational commitment to patient privacy. The role that Mayo Clinic is really trying to play is, again, helping that facilitate those connections. We really want to drive industry standards where people can easily collaborate with each other and communicate their knowledge. We don't want to be at the center, but we want to make sure that that's a seamless and effective. And the way that we're doing that is sort of standardized data frameworks and tools that you can get actionable insights. So really working globally to bring those data pieces together. So what I would kind of say, is kind of wrapping up my kind of final thoughts are that there is a need for unified action, and it requires a coordinated global research effort. And Mayo Clinic is very interested in partnering with everyone in the room as well as online. And it's organizing these international research networks, taking the strengths of each group, the collaboration, and let's focus on specific challenges. Maybe it's climate-driven infectious disease surveillance, heat health impacts, but we need to figure out how to make the healthcare system sustainable. And through that, we can really look at what kind of global impact we can make. So excited for this session with you, and appreciate so much the invitation to participate, and happy to follow up or with anyone that's shares an interest in working more closely. Thank you, Edson.
Thanks, Eric. I think the next speaker is Jerome Kim, Director General of the International Vaccine Institute. And I apologize for not being a proper host to make an introduction with all background and bio information on your biograph, sorry. And but this is just in the interest of time. But thanks again, Jerome, and it's over to you.
Thank you very much, and I really appreciate the opportunity to speak at this very important symposium on climate change and its impact. So my topic today is vaccines and climate change, and as I was introduced, I'm the Director General of the International Vaccine Institute, which is a small international organization based in Seoul, South Korea, with a mission to discover, develop, and deliver safe, effective, and affordable vaccines for global health. You can see where around the world we work. Actually, the map needs to be updated because we're also now working with Professor Clemens in Brazil. But you can also see that on a day-to-day basis, the 270 people at IVI work across the vaccine value chain, starting in the laboratory, going into human clinical testing, to the delivery of vaccines and changing the way we use vaccines. And then very importantly, understanding where the burden of disease exists. And all of these things contribute to the development of innovative vaccine solutions to infectious diseases, bacterial, viral, and protozoal. You can see some of the flags of the member states, including Brazil's. I think one of the most important things that we have to deal with now are the great challenges to society. And I think everyone recognizes that climate change is one of these, but there are others as well. There are things that we as a human society are doing to the planet. There's population growth, or actually now in Korea, it's population contraction, which causes a different set of problems. Scarcity of natural resources, whether these be water or clean air or other things like heavy metals that are important for batteries, conflicts, and then problems that come out of society. And we know that all of them are related. We can't consider any of them in isolation because they do in fact relate to many of the other problems that we face. And the other part of this is that global health is something that intersects all of these. So if we're thinking of a global health solution that only deals with one thing, then we're often going to have a partial solution. And the problem with partial solutions and solutions that don't work perfectly is people will then say, well, it wasn't really a problem to begin with. But we know that climate change is a problem. So there are lots of examples of ways that, the way society interacts with the planet, so deforestation, the way populations interact with wild populations, so zoonosis and transmissions between or spillover of pathogens from animal species into human species, the impact of the scarcity of water on drought, which then brought famine, so scarcity of food, which then caused refugees and mass migration associated with large outbreaks of cholera and measles. You see what happened with a conflict in Rwanda, refugees in Goma, the largest cholera outbreak and the greatest number of deaths we've seen in a long time. And then, of course, society, we don't have to look very far to see problems with the way we interact with each other. And this is just a protest during COVID in Italy. So let's just remember that global health is a part of all the problems that we face as human beings on planet Earth. And climate change is complicated because when we think about the way climate change might impact the vaccines that we develop, or how the vaccines that we've developed might impact some of the complications of climate change, we have some very complicated things. And so for those of us who are not, big numbers experts and can't do all that kind of calculation, it might be good to just break climate change down into some simple things like warming, precipitation, floods, droughts, storms. And this chart then shows you how each of these different aspects of climate change impacts different types of diseases, vector-borne diseases, waterborne diseases, airborne diseases, diseases that are caused by direct contact, foodborne diseases, which actually can be related to waterborne diseases, and then a number of unspecified things. And you can see that, viruses, bacteria, things that occur in animals, fungal diseases, protozoal diseases like malaria can all be impacted in different ways by different types of climate change. So we have a problem, and it's a complicated problem, and it's a huge problem. So other than theoretically, practically, what does that mean? So we know that there is more severe weather. And because of that severe weather, there are floods, destruction of infrastructure, refugees. There are droughts, which cause food scarcity, refugees, mass migration, and then other infectious disease outbreaks. We have endemic diseases like cholera, which is endemic in much of Africa, becoming epidemic when people are put into situations where they don't have access to clean water. And I know people are saying, well, clean water, that should be simple. That's something Brazil has achieved. That's something has been achieved in Korea and other countries around the world. It's estimated by UNICEF that the cost of clean water at a medium income country level is probably $120 billion a year. The cost of oral cholera vaccine, $1.30 a dose. So yes, there are solutions. There are definitive solutions, in fact. But are we willing, again, to pay the cost? So looking at other things like heat, foodborne illnesses, and warmer temperatures and changes in precipitation often mean that vectors can migrate. So now we're seeing malaria, which was initially confined to the coastal regions of Kenya, moving farther up. Moisture, so increased precipitation, causes vector-borne diseases. Actually, I didn't mention this, but we often think of cholera as a waterborne disease. and it occurs with flooding and other things, but it actually occurs in the setting of drought as well, because the cholera bacteria are concentrated in these limited pools of water that humans and animals have to use. So cholera, like many diseases, has two faces, and it can affect you either in flood situations or in droughts. The spread of rodents, again, human populations, trash, destruction of infrastructure caused by weather. And then a really important question for those of us who develop vaccines, is there space to add more vaccines? You know, we develop all the vaccines against all the different diseases, but if we did, who would use them? I mean, people already complain about the 20 or so different injections that a child gets that prevent the majority of the childhood diseases. Are we going to be able to accept additional vaccines for waterborne diseases and diseases caused by vector migration? So how are we going to think about this? What new and innovative things do we need to think about as vaccine developers in order to improve uptake of the newly developed vaccines? So vaccines that might impact or mitigate the impact of climate change. And so there are some approved vaccines. Cholera vaccine has been approved since 2011. 200 million doses have been dispensed. There's a global shortage of cholera vaccine. And IVI and other organizations are trying to increase that supply. Typhoid vaccine. We've had typhoid vaccines, and we have a new and improved typhoid vaccine that is 80 to 90% effective in controlling the disease, but we haven't implemented full vaccination. Dengue vaccine, chikungunya vaccine, malaria vaccines, all of these things exist. It's important to note that the use of the approved vaccines hasn't been optimized for climate change. It hasn't been optimized in general for general populations, optimized in the sense that we have the disease under good control in situations where there's a high burden of cholera, typhoid, dengue, chikungunya, or malaria. We tend to respond to outbreaks, and outbreaks are just the tip of the iceberg. Often that's in the setting of endemic disease, which we could control with vaccination, but we need to think comprehensively about a solution. There are other vaccines that would be needed as climate change worsens. They're already needed today. A vaccine against Shigella, what's used to be called dysentery. Vaccines against E. coli strains that cause diarrhea. Invasive non-typhoidal salmonella, which often occurs in the setting of malaria. Diseases like Congo-Crimean hemorrhagic fever, which almost no one has heard of, but it's a big problem in the Mediterranean, and it's been spreading. It's now spread into France and Italy. Why? Because climate change and increased temperatures allow the vector that transmits Congo-Crimean hemorrhagic fever to migrate northward. Lyme borreliosis, an increasing problem in countries in Europe and in North America, and then other vector-borne hemorrhagic diseases and encephalitides caused by viruses, which are spreading because their vectors patterns of transmission have changed, or because in some settings, the viruses themselves have developed mutations that allow them to go into new vectors and spread in new and different ways. So we need innovation. We need new vaccines. We need new platforms. So for instance, can we put 6 vaccines on a patch? You put the patch on, you don't need a nurse to inject you. Put the patch on, 5 minutes later, you take it off and you're vaccinated. That would decrease hesitancy significantly, according to some parents that it's been tested on. New combinations of vaccines. So can we count on a single cholera vaccine? Or since we know that cholera and typhoid and Shigella all appear in similar geographical areas, could we make a combination vaccine that includes all of them? Well, combination vaccines are expensive to develop, are difficult to develop, and we'd have to get different companies involved in the development of it. So again, all these things that we call impediments, but if we were really committed to this, we could. New routes of delivery. So can we give vaccines intranasally? Can we give them orally? Again, it makes it easier to administer. New adjuvants. So adjuvants are things that make immune responses stronger or last longer. And with the right adjuvants, could we ever get to the point where every vaccine was only a single dose? Again, these are innovations that need to be developed and then tested in human populations in the way that Professor Clemens described for the COVID vaccines. Now, think about a vaccine that's going to mitigate the diseases that are found in climate change. And you saw that huge list. It's not a single vaccine for climate change, and this is going to be a complication. We need new thinking around vaccination. We need funding, but as developers, we need to think We need to develop these vaccines faster, better, and more cheaply. But importantly, when you look at this list of vaccines, by and large, they're unincentivized. These are vaccines that are not going to make $35 billion like COVID vaccine did for the mRNA companies. These are vaccines that will probably need to be sold for $1 to $2 a dose. And what company is going to risk $1 billion to develop a vaccine that will cost, that will bring them $1 a dose? So 3 final thoughts and observations on climate change and disease. So the first thought is that there's no vaccine for climate change. It's a series or multiple vaccines. Vaccines aren't a solution to climate change, but they can partially mitigate the impact of climate change directly. Indirectly, the impact of climate change on other climate-dependent aspects of health, so on human health and well-being, can also impact vaccine effectiveness. So the reverse is true, that some of the things that climate change is doing could potentially decrease the impact of vaccination. So we really need to know. And I think an underlying problem here is that denial of the reality of climate change, for instance, pulling out of the COP, and denial of the effectiveness of vaccination, that is, dropping vaccination programs or research around mRNA vaccines, may have a similar demographic and a similar population. And we really need to, as scientists, be able to think clearly about innovation and how we talk about science and how we convince populations that vaccination is something that will be beneficial even in the setting of climate change. Thank you.
Well, thank all the speakers. I hope this gave you a very broad range of information in regards to the effects of climate change in health and also the challenges we've seen, many information related to the challenges on keeping the data and patient privacy standards, and at the same time providing useful information for each single subject. At the same time, the idea that it's really important to share genetic, genomic data and also integrate information from different sources. And also we have to think about the vaccination strategy, as we just heard from Professor Kim. So these are many points that we have to address in this meeting. And of course, this is just the start of this process in this morning. Thank you all for this session. Thanks for the speakers again.
Okay, now we are going to our last panel here, which is better. We are going to discuss ways to reduce the environmental impact of science and train researchers in light of One Health concept. This panel will address the environmental impact of scientific production and the ethical concerns arising from research waste and when replicating fraudulent research. We will also understand some strategies to enhance sustainability in research laboratories and minimize their environmental impact. We will also explore how One Health concept can support interdisciplinary research, training to better address complex challenges like the climate collapse and global health. So in this panel, I would like to introduce Giulia Cacisi, is a PhD researcher at Einstein, Jordan Ridgeway, Sales Director of Impact Laboratories at My Green Lab from United States, and Anna Carla Goldberg, Scientific Integrity Consultant. So could you take your seats, please? And Jordan is online, okay.
So So good morning, everyone, or almost good afternoon. It's a pleasure to be here in this final panel. My name is Julia Cacisi. I'm a PhD student at Einstein and also a research nurse here. Today, I'll be presenting about our institutional research group that we call eNature, Interdisciplinary Studies on Climate, Connection with Nature, Health, Well-being, and Biodiversity Conservation. I'll be sharing, coordinated by Professor Dr. Elisete Leão. I'll be sharing some of our projects that explore the connection between nature and human health and promote engagement in environmental conservation among different populations. So to begin, we are living in delicate and uncertain times for human health and the survival of the planet as a whole. And the science challenge in this context is huge. So natural systems are collapsing and this directly impacts human health. So when we think about the wildfires in the Pantanal biome, it's much more than just the loss of biodiversity. It's increasing worse air quality, increase of respiratory illness, and disrupt the lives of entire communities. At the same time, climate change does not affect everyone equally. So some regions like the Brazilian Northeast, you can see that suffer disproportionately about it. Drought impacts food security, limits access to clean water, and intensify social disparities. And finally, there is no sustainable human health without social justice, ecological balance, and political action. This is why we see more and more people around the world protesting for climate justice. So, there are different health frameworks today, ranging from more traditional to more integrative approach. The first level, is the public health approach, which focuses primarily on population health, emphasizing policies, public campaigns, and disease prevention mainly. Next steps come global health. Global health expands this perspective by recognizing these disease, health systems, and inequality transcend national borders. The concept of One Health, that is the theme of this panel, goes even further. It goes acknowledge the interdependence between human, animal, and environmental health. It's particularly relevant when addressing zoonoses, pandemics, and the sustainable use of natural resources. And finally, we arrive at planetary health, which brings all these elements together and connects them to the planet's ecological boundaries. So understanding these health frameworks also invites us to reflect on how science itself is practiced. So we need to recognize science as an ecological practice. Evidence shows that life science research generates high carbon emissions due to chemicals, equipment, and energy use. And it's estimated that one single bioscience research can produce nearly 1 ton of plastic waste annually. So it's a lot of waste. We need to think about it. So in this context, it is crucial that a science align with One Health and planetary health perspective must be ecological, not only its goals, but also in its methods. This means integrating environmental care into the daily practice of research, rethinking our own ecological footprint. And as you know, this is our teaching and research center, a space that supports high-quality projects across various fields of knowledge. And here I'm highlighting just some of our research lines, such as immunology, data science, molecular biology, neuroscience, nature-based studies, which is the one I'll be focusing my presentation. And among the diversity of research lines that we have here, some questions stand out. So what are the possible pathways? And what is our role as scientists and future scientists? The answer lies in a science that is more deeply committed to care for both humans and non-humans and to the territory transformation. So what are the keys along this path? So the next slide, I'll be sharing with you some of the directions we have been exploring with the eNature group. Within the nature group, we develop nature-based interventions focused on health outcomes, especially well-being. We work across three main pillars: health, human health especially, and connection with nature and ecological awareness. As you can see in the image, more than a research initiative, nature is an invitation to reconnect with what sustains us. So the first point I'd like to share with you is the importance of recognizing research as a form of care. Our project aims to explore the health benefits of nature contact across diverse population. So we have projects that include health professionals, we have projects that include children, senior adults, and patients living with disease. So these studies focus on outcomes related to health promotion and well-being, whether in hospital, in primary care units, or in conservation areas. We also carried out initiatives involving the production and the analysis of public data, integrating socioeconomic, climate, and environmental information. Our goal in this scope is to understand how territorial inequities can influence the incidence, progression, and mortality of disease. The second essential key I want to share with you is the importance of recognizing nature as a public health infrastructure. So we know that health ecosystem provides public health service on their own. So they purify air and water, regulate climate, and support life. But beyond this environmental service, nature also impacts us directly, physically, mentally, and emotionally. Scientific evidence shows that contact with nature helps reduce negative mood states, blood pressure, and heart rate, while increase positive emotions, well-being, and even support immune system function. And more than that, it fosters a sense of belonging. And when we feel we belong, we are more likely to care about nature and its resources. Another essential key in this process is the interdisciplinarity. Scientific knowledge reaches its full potential when connects and engages diverse stakeholders. Plus, the challenge that we face with climate change demands collaborative solutions. That's why our projects are developed in partnerships with a wide range of professionals institutions, both national and international. We work alongside engineers, physicians, nurses, biologists, public policies experts, photographers, each one bringing their unique perspective and knowledge. As you can see in this slide, the strength of our work lies in these diverse collaborations built over the years since 2014 when we found the research group, and is still expanding. And recently, through a partnership between Einstein and USP, we launched a working group on nursing and planetary health, as mentioned as Dr. Guilherme in his speech. So the last key I want to share is that a science aligned with One Health or planetary health perspective needs to go beyond observation, diagnosis, and treatment. Must be integrated with education, generating knowledge that leads to concrete action, action capable of transforming realities and creating territorial impacts. This means focusing on practices that are truly transformative, that reach the ground, and positioning science as a bridge between knowledge and social engagement. As an example of this perspective, at our institution, we have the program that we call Scientists of Tomorrow, a program coordinated by our research board. It offers immersive scientific training experience for young students, bring science close to communities. Within this project, we developed the In Nature Ambassadors with the goal of engaging these students in climate action and planetary health, build on the belief that young people can and must lead the change. This program highlights science as a tool for community empowerment, not just within academia, but far beyond this. So before I close, I'd like to share a few key take-home messages. First of all, there is no health science on a sick planet. Bioscience research must be integrative, expanded, and connected to planetary life. And they need to foster the development of research with a social environmental commitment in parallel with their academic formation. And to close, I like to share an image that symbolizes the analogy between a human fingerprint and the rings of a tree. Much like trees, we are imprinted by the environments we inhabit and the experience we undergo. May the science we produce carry these imprints of care, of belonging, of a commitment to the earth and to all its inhabitants, both humans and non-humans. Here are our contact details and a QR code to our Instagram for those who would like to follow our projects more closely. Thank you. Now let me invite Jordan Ridgeway, Sales Director of Impact Laboratories at My Green Lab. Are you there? Okay, nice. You're welcome.
I am, and thank you all for inviting me here today. It's quite humbling to be able to speak with some of the brightest minds on the planet. And so I've got a small presentation today that I'd like to share with you all. And I've spent the last 15 years working in environmental testing and lab operations. And while I'm not a scientist, I'm not a PhD, and certainly not a paid public speaker, I do want to make it as painless as possible. And one of the things that I love about working in labs or with science in general is that the tests and research that we do is in order to make the world a better place. And scientists are at the heart of that. But we run into some very common issues. And so looking around the labs that you work in, I'm sure it's quite apparent that there's tons of waste. It could be, bagged up hazardous waste. It could be regulated medical waste. And then when you start to look at some of the instruments that you work with, whether that be biosafety cabinets or fume hoods, they consume massive amounts of energy. And that's sort of the fundamental contradiction. Our own labs are significant contributors to the growing waste and energy burden. And so what I wanted to talk to you all today about is, how we're going to tackle that paradox. And one of the things that My Green Lab does is it provides sustainability initiatives that help push sustainable science forward. And so my goal is by the end of this, you'll have some actionable strategies for sustainable lab management that will benefit your operations, your budget, and your broader institutional goals. And so who is My Green Lab? Well, My Green Lab is a global nonprofit with a mission to build a culture of sustainability within science. And we do that through three primary paths. We do it through research and advocacy, education and engagement, and we also do that through certification. And that's what we're really going to focus on today, is on the My Green Labs certification. And the reason it's important is because labs are some of the most resource-intensive buildings on the planet. So on average, they consume 10 times more energy than office spaces, 4 times more water, and they generate 5.5 million metric tons of plastic waste each year. And that's a massive environmental footprint. And they're not just statistics, they really do represent a significant financial
Jordan?
and environmental burden
Hello.
that we have
Sorry to
power
interrupt
change.
you. We are seeing
Yes.
here just your notes. Your presentation is not complete for us. We can see your notes.
I'm sorry, that was supposed to be,
No, the same.
oh. How about this?
Yeah, that's good. Sorry.
Apologies. So what is the My Green Lab certification? And what it is, it's a software solution that we provide to help you reduce your environmental impact. And it's important because not only can it help increase employee engagement, but it can actually lower your carbon footprint, certainly lower scope 1 and scope 2 emissions. But more importantly, it's an actual, monetary savings as well. And the companies that we work with typically see a 5x return on investment by working with our program. And we cover 14 different topics of sustainability within the certification itself. And these topics are listed in the bottom left screen here. And when we talk about the monetary savings, I wanted to give you some real life examples. And so in 2021, AstraZeneca invested $60,000 in My Green Lab certification for part of their R&D labs. And by the end of the year, they had reported an energy savings of 1.2 million kilowatt hours of energy. And that translated to over $300,000 in savings. And that's 4.3x return on investment. And it's only from the energy portion within our certification. And keep in mind, there's 13 other topics to work with. And a more recent example is when we worked with GSK. And GSK enrolled 3 of their labs as part of our pilot program of the 2.0 certification, which officially launched in January. And by the end of the pilot, they had saved almost 500,000 kilowatt hours of energy, 136 million liters of water, which is the equivalent of about 55 Olympic swimming pools. And when you can look at those savings, it was eventually over $200,000 in cost savings across 3 labs. So it's actually even higher return on investment with our 2.0 program. So what does the path to certification look like? Well, it's very simple. We start with an engagement survey. And this is something that the lab members are going to take. It's a quick 10 to 15 minute survey. And it's really designed to provide a baseline for where your lab is at with sustainability. And based on those answers, we'll move to step 2, which is the implementation phase. And this is really the longest phase of the project. And based on your results of the engagement survey, we make recommendations for change. And these are small changes meant to be done over a long period of time that you can take within the lab and work at your own pace. And it does help build the culture of sustainability. And after 3 to 6 months, when you feel like you've hit a good spot, you can apply for certification. And you do that by taking the engagement survey a second time. And the idea here is that the answers are going to change. And based on those results, we actually issue a certification. And where my company comes in, Impact Laboratories, is the certification has to have some validity. And so we actually offer the third-party verification for the My Green Lab certification. And we're the world's only sustainability certification that's third-party verified. And we do the verification through a series of checks, basically to ensure that some of these changes have taken place. So if you say that you now have a sustainability policy in place within your lab, we might actually ask for a copy of that document to be uploaded to our software platform. And I wanted to share with you what it looks like. And so this is the certifications hub. And you can see here, we're still within the 4 phases: the baseline, the implementation, the certification, and then the review. And more importantly, it's customizable specific to your lab. So for example, if you don't work with autoclaves, like in this picture, it's a toggle switch on and off. And here's an example of what some of the questions might look like on the engagement survey. It's important to note that it's something that could be done over a mobile device or a PC, and it's available in 7 languages. And again, this is very quick. It's 10 to 12 minutes, and on average, about 25 to 35 questions. And as we get into the assessment tool, this is really your project management tool, and it gives you the ability to see in real time some of the actions that you're working on and exactly where you're projected to score as far as your certification. And what's important to note here is that actions that have the most environmental impact are weighted more heavily. So depending on what actions you might take, it determines what your certification score might be. And so, for example, if you see that, based on the actions that you're taking, that you're going to score at the silver level, and there's only 2 or 3 more actions you could take that might get you to the gold certification, you have the ability to extend that timeline up to a full year to hit the certification level that you're aiming for. But the most impactful tool that we have is actually the impact estimator. And the impact estimator is based on regional utility data. So we've partnered with a third party to provide information that's specific to your lab. So the electricity cost in Brazil would look quite different from the electricity cost where I'm at in San Francisco. And what we have are preloaded actions that you can take, something as simple as shutting the sash on the fume hood, that can give you real insight into what the cost savings is, the energy savings is, and also the carbon savings. And we give you that information right here in the platform. It's completely customizable, so you can actually work with facilities or management to get more exact data. And you can always add custom impact actions as well. So if there's something that we don't list within the platform, maybe a piece of equipment that you work with on a normal basis, you can always add that in to calculate your exact savings. And I think it's important to note that you're not alone in trying to make the world a better place and save energy and save on waste. And so right now we work with over 4,500 labs across 50 different countries. And that equates to almost 50,000 scientists that we work with on a global scale. And one important thing to note here is that we have over a 90% renewal rate with the labs that we work with. So once they start engaging with the platform, they see the real value and the impact that they're having, and they want to continue to update and work on the change within the lab. And we also partner with 43 of the top 50 largest biotech and pharma companies in the world. And it's important because these are the global leaders in science. And as you can see here, some of the names that are highlighted in bold are companies that have top-down strategies in place for My Green Lab certification. And so I'll highlight some like AstraZeneca, who have a commitment to having 100% of their labs, My Green Lab certified, by the end of this year. And so what this says is that, sustainability isn't just a nice to have item anymore. It's really a strategic imperative, and it's led by the biggest companies in science. And we also work with tons of different companies as well, and these are all asking you to make a commitment to sustainable actions in your lab, something like the My Green Lab certification. And I want to thank everyone for the time today. I'm sorry for the technical difficulties, and I really appreciate being able to speak with you today.
Thank you, Jordan. Now let me invite Dr. Ana Carla Goldberg. She is a scientific integrity consultant.
Well, hello, everybody. You're still here. I'm a big fan of My Green Lab, I must say. And I was thinking what I could bring to you. And actually, I would like to put a grain of salt here in all this. We have been talking about these beautiful initiatives. They are all much needed, and I congratulate all of the speakers. However, at the end of the day, who makes the clock tick, who makes everything change, are the researchers, are the people who are producing science. So I would like to tell you a little bit about my personal journey towards sustainability, which was always a very important issue for me, to show you how how important initiatives to bring the researchers on board so they understand the importance of why a lab should be sustainable, why a researcher should be sustainable, what is his own carbon footprint, which is something which is largely ignored. Okay, so I hope you have a little bit of fun with my personal story. Let me just discover how I go on here. Okay, so this is me, 70s, graduate student, and you can look at the behind me. The glass is broken, the tiles are missing in the laboratory, and that was my first scientific mission, working very hard to make something which was good science, which could be reproducible and would have an important answer. It was very difficult. Continuing on my next lab, which when I started on my immunology journey, you can see the lab was already had more equipment, but cramped, completely cramped, everybody working together, and lots of equipment spread around all over. And me working on the computer with sunglasses because the light was so glaring on top of the computer, which was sitting in the middle of the lab. That's where we studied. This is my next lab with my boss, very happy with a brand new lab, that's 2001, with all the containers in the corridor you can see, because there was no safe place to put the liquid nitrogen cell containers. Continuing on my next lab, which was an experience in clinical trial, in a clinical trial with a human islet transplantation unit, which was a very complicated issue with a clean space to work, and it was very cramped, it was very small, it was completely out of place. It was located in the Chemistry Institute, which was the last place you would put a human cell unit to process human samples. And ending in my last address, which was the Einstein, where I was managing the facility now, a real facility, for molecular biology, special equipment, cell biology, where everybody was sharing the space, sharing the equipment, sharing the storage, and sharing studying spaces, talking spaces, and with micromanagement needed, as you can see, because everybody was stuffing their samples into the freezers and nobody found anything anymore. So it's a learning experience. To work sustainably is something that each student, each researcher, each scientist has to learn along the way and pass it on to the future generations. And of course, none of this works unless you have the shared spaces, the project management, the graduate program, the biobank, a red cap system to control clinical samples, international cooperation, certified animal facility, external boards, research integrity and compliance, and science, and more science. To produce the good quality science, which is now the hallmark of this institution. 2020, when the new building was inaugurated, we pored over, I'm missing a slide here, doesn't matter. We pored over the plans of this new building for 3 years, discussing every nook and corner of the lab, what would go where, to optimize the use of this facility for the best quantity or best number of researchers possible and students, so they could benefit from a state-of-the-art installment. Something happened here. I lost 2 slides apparently. No. So here, this is the end result of the 3-year discussion of how to establish these labs. Here you can see here on this side. You see here my pointer. You see the pointer here. All these are lab units, and the central lab unit, which I nicknamed OCA, which is the name of the central construction of the Amerindians in the Amazon forest, where they live together, where they cohabitate and do all the family activities in this, and community activities in this big central building. And finally, what I'm doing today, which I'm trying to extend this experience to whoever is interested. I have a pile of visiting cards on the table if somebody is interested in my current work. Thank you.
So I would like to thank you to everyone who participated here in person or online. It was a great time here. A special thanks to our speakers for sharing their experience, the inside team, especially Amancio and Julia, for their partnership, and the Einstein Technical and Institutional Communications departments for making this meeting possible. As we wrap up this discussion on science diplomacy, climate, and health, our conversation continues online. So we will be publishing interviews with our speakers today, and more content related to today's topics. To stay up to date, you can follow all of these on our website here. All content is published in Portuguese and in English with fully open access. Okay, here is the Portuguese page, but you can find it also in English. Okay. Additionally, we offer a free bi-weekly newsletter, and we are also active on LinkedIn, where we share content related to scientific careers. So we can find us in this social media. Finally, I ask that inside students please remain in the auditorium, okay? And for all, thank you all once again for being part of this meaningful event, and wishing everyone a wonderful day ahead. Thank you very much.